I am now joined by Dr. Muhamad Aly Rifai with the latest on Dr. Neil Anand's case and to share his own story of what happened with him. He's a psychiatrist, internist, addictionologist, and researcher and expertise in telepsychiatry, neuromodulation, and more. So thank you so much for joining me. I hope I've been saying your name correctly. Please correct me right now.
You got it right.
I didn't get a chance to talk to you ahead of time. So.
Thank you. Thank you for hosting me to talk a little bit about our colleague, Dr. Neil Anand. Unfortunately, last week, he received bad news from the jury. They convicted him on all charges, quite unfortunately. So we're working through the appeals now to the appeals court, to the Third Circuit Court of Appeals to appeal his case, because a lot of illegal things and invalid things that were done in his prosecution. That took 6 years. He's been waiting for 6 years to get the jury, and then the government just makes up all the rules and makes up all things, and unfortunately they were able to deceive the jury into giving him a guilty verdict, while his 3 other co-defendants were found not guilty. So it's quite unfortunate at this time, and that's the I faced the same battle last year. I went to trial. I said no, I will not plea, and I was lucky. My lawyer was able to convince the jury that I was not guilty, and I was completely exonerated. And I'm now back in practice in my office, but it's unfortunate. It's just the government is just targeting physicians who care for their patients, physicians who care for individuals who are the underserved, the individuals who are dispensable for the government. Doesn't matter if you're not able to provide services to your community and you're gone, the government takes you out, and these people are left with no doctor to help them. They can turn to the street for drugs. They could have no services. It doesn't matter for the government, and it's quite unfortunate what's been going on. But we continue to support our colleague, Dr. Neil Anand, and we're going to continue to support him in his struggle with the government for appeal.
Yeah, I mean, the ramifications of this, the ripple effect on so many levels is profound, and it's unfortunate that people are so ill-informed. We've dealt with propaganda campaigns for many years, but it's really letting the criminals get off the hook, and then it's allowing doctors to become easy targets, and no one wins from this situation. I really encourage people to watch that entire interview with Dr. Neil Anand. It doesn't take a rocket scientist to hear from him, hear his story, and feel compassion for him, that he's certainly not a drug dealer like the government tried to make a case against him for. He's a compassionate physician who is trying to help his patients, and he really focused in on this method, this unscientific method, now this artificial intelligence program that is purported to identify whether certain people are receiving too high of doses or too big of mixtures, and it's allowing a machine to interject itself in between the doctor and patient relationship, and really, as you said, can be used as a tool by the government to attempt to bring more of these cases, and feel the government can say it's doing something about this actual real drug problem, when really it's just causing so much harm.
Absolutely. I mean, I think in my case, I live and practice in rural Pennsylvania. Dr. Anand is in the suburbs of Philadelphia. I'm probably about an hour from where his practice is, but I'm in rural Pennsylvania. And when I was indicted, a lot of my patients lost access to my services. And within 2 years of the loss of access to my services, the rate of suicides, the CDC recorded that the rate of suicides increased measurably in my area, just because people had no access to a psychiatrist, to an addiction medicine doctor who was helping them. And the government didn't care. It didn't matter with the government. And when we went to trial, it turned out that they just collected evidence that was meaningless. We showed it to the jury that everything that they collected was meaningless. There was no evidence that I did anything wrong. They just wanted to scare people. And, I didn't scare. I wanted to go to trial. I proved my innocence. We found out that the government, whatever they were saying, wasn't correct. They just collected information and targeted individuals who are minorities. They're targeting minority physicians, African Americans, Hispanic, Indians. I'm of Middle Eastern ancestry, but I'm born and raised in this country. I served this country. I was in the public health service, like my colleague, Dr. Neil Anand. He's a 9/11 hero. He was on the 9/11 site within a day, helping patients, helping first responders. And and he's a lieutenant commander in the Navy. And this is what the country repays him with: a prosecution, and they want him to go to jail for a long time. And he just serves his patients. He serves the underserved population that nobody cares about from Washington, because these are the dispensable. These are the people in rural Pennsylvania that nobody cares about. But we are here as physicians. We are healers. Unfortunately, in my case, for example, the United States attorney who was fired by President Trump, on her way out, she called all doctors in her district. She called them dirty doctors who poisoned the community. That's how she put out a press release and said that we are dirty doctors who poisoned the community. All doctors, not just doctors that she prosecuted. She called us all dirty doctors. And thank God that President Trump fired this U.S. attorney and she's no longer there. But this is what we deal with on a daily basis from the United States Department of Justice, unfortunately.
Yeah, and I mean, poor Dr. Anand. I mean, this has been like such a long road, as you said, 6 years just to be brought to the case, and in that time, because of like so many January 6th victims, he had a surprise raid on his home. He had a divorce. The strain that all of this has caused, and it all stemmed from him just trying to do his job, to be a compassionate doctor. And people are so ill-informed on this topic. I'm really passionate about trying to tell these stories. Every journalist is supposed to be a voice for the voiceless, and my heart is broken that there are so many that feel like they don't have a voice, that are suffering as you and I speak right now, suffering and afraid of like how they'll be able to function. There's such a pariah on those that need pain medication, that truly need it to function, and don't ever exceed their dosage amount or anything. That I've gotten countless emails and stories now from folks who've been like, I've been on this certain protocol after a spine surgery, never had to increase my dosage or anything like that for 15 years. And then suddenly they have to worry about what is their ability to have freedom. There's people that truly can't function. The pain is so debilitating that they can't even function and have a proper life. And now they have to worry, because of this new agenda, about if they're going to get to live and be able to accomplish anything. It's absolutely heartbreaking. I'm going to do my best to try and get to as many of those stories as I possibly can, but I'm only one person. But this is just the other element to this that I feel compassion for is we all of us, anybody listening, I'm sure, has had to go through this period of what we call self-censorship. When they were cracking down on people, you couldn't say that perhaps the COVID-19 came from Wuhan lab. You couldn't say that the vaccine wouldn't protect against transmission. These are things that people got demonetized for, people got kicked off. And so it led to people even now feeling like they have to self-censor. And so what we're seeing happen in this topic, I believe, is that certain doctors, they may know what's best for a patient, but now that they see other doctors being prosecuted, their lives being destroyed, they're having to self-censor what they think would be best for the patient, right? That's the other element of this, correct?
Well, believe me, this physician is not self-censoring. So I am in the process of writing a book. The book title is Doctor Not Guilty. And I am going to reveal all of this. I'm going to write about it. And I'm actually 3/4 of the way through this book. I speak on a regular basis. I have a YouTube channel. I write on X all the time, and I write blogs specifically exposing the issue of prosecution of physicians, because I think it's unjust. I think it affects the morale of physicians. We already don't have enough physicians. Now we're taking away physicians from the community, and especially the underserved community in my areas. I mean, middle America, there's not enough physicians. And the government now is prosecuting physicians, is jailing physicians. This is the only country in the world where we have the highest number of incarcerated physicians on the face of the earth. This is the country where they incarcerate and prosecute close to 500 physicians every year, the United States Department of Justice. So we have the highest number of incarcerated physicians on the face of the earth. So basically, the Department of Justice just found a punching bag to basically, instead of going after the cartels, because we are in nice offices. I'm in my office. They would come and raid my office. There's no weapons. There's nothing here, as opposed to go and raid a cartel penthouse where there is machine guns and firearms, and they're going to fire back at them. They come here to my office. They pick me up. They take me to jail. They do court and they convict me, and that's an easy win for them, but not for the cartel. And so you see how in the media now, even the other side, they're basically promoting the gang members and the MS-13 gang members, and people are advocating for those. And we, the doctors, we are the members of the community. We are the outstanding members of the community. I don't know if your audience know, but physicians have always been in the center of this democracy. The Declaration of Independence was signed by 4 physicians. It was 4 physicians signed the Declaration of Independence. One of them is a psychiatrist, Dr. Benjamin Rush. He's the father of American psychiatry, and he's one of the signers of the Declaration of Independence. Dr. Benjamin Rush actually led the Pennsylvania delegation to ratify the Constitution. So physicians have always been the pillars of the community. We've always been at the foundation of democracy in this republic. And now our white coats are being replaced by orange jumpsuits, jail orange jumpsuits. And that's quite unfortunate. This is quite a transformation from the pillars of this community, from the foundation of democracy, to being haunted as criminals. We are not criminals. We are healers. We support our community, and we support our colleague, Dr. Neil Anand.
And I think that there's another element to this that we haven't really touched upon. The other element that you're having to fight against is the disparagement that some doctors brought upon themselves, those doctors that aligned with the government and were willing to do whatever the agencies and government were dictating to them, and became their foot soldiers. The doctors who kept loved ones from their family members when we were experiencing the coronavirus and keeping them separated. The doctors that refused to try the medication family members or patients asked for during the pandemic. And so I think there is a lot of this animosity toward doctors, those kinds of doctors that make it harder for perhaps conservative media to listen to this current plight of doctors of courage, as Dr. Anand wore. We need to remember the doctors who were heroes during that pandemic, who stood up for the doctor-patient relationship, and who have great moral character and were not allowing the government or the agencies to dictate how they cared for their patients. And so I think that that's another element in this that you're having to fight, is the stigmatization of certain white coat wearers, if you will. And
Sure.
so, I mean, that's got to be really tough as well, right?
Yes, and but we're basically we stood with our community when the COVID pandemic came. We stood with our community. I was there. I was supporting my community, but the government didn't care. The government had no interest in basically supporting the community. People now are crying that President Trump and Secretary Kennedy are basically reducing the number of employees for the Department of Health and Human Services. But they were not there when the pandemic was happening, half of the employees were not showing up. They basically were not available. They didn't even open their emails. They didn't sign into their computers. The Department of Health and Human Services employee, half of them for 1 year didn't even sign into their computers. So they were not there. And so there's no tears that are being shed on some of these employees being let go. And I'm a full supporter of Secretary Kennedy and President Trump in reducing and DOJ to reduce the number of these employees, because they're not needed. They didn't make any difference. It was additional regulation that didn't help the health providers, didn't help the community, and actually made things worse. So less regulation is very, very important. And I think that's the message that we learned from the prosecution of Dr. Neil Anand and the other physicians, is that we definitely need less regulations. The agencies that are in charge, Health and Human Services, the DEA, they need less regulations. Have them go and fight the cartels. They shouldn't be butting into the doctor-patient relationship. They shouldn't be butting into the relationship between a physician and the patient, or the treatment in the community. They should just go and fight the cartels. No, nobody's fighting the cartels. They're just roaming around in our cities. And the DEA agents, what's the best that they can do is they can come to doctors, air-conditioned offices. They're nice offices. They come. They do inspections, they arrest doctors, and they prosecute them, and they don't go after cartels. And it's quite unfortunate. This is what we see. What's happening right now is that the cartels are roaming pretty wild, and they're pouring in fentanyl into our communities. And it's not that the prescribed opiates are the ones that are problematic. It's the fentanyl out in the community. That's what's leading to overdoses. That's what's leading to death in our community. So basically, less regulations is definitely much, much better than the situation that we were in before.
And so we're up against such a Goliath when it comes to the propaganda campaign that has been allowed to persist, and the priorities of this administration, not knowing about these many voices that are suffering right now. What's the best way forward? What can we do so that future jury panels don't already come in with their own biases and are allowed to have rogue justice systems targeting the wrong individuals, those that are trying to help people, as opposed to those that are resisting deportations right now? I mean, how do we get our priorities realigned, and what can us as individuals do to help in this effort?
I think speaking up, I am speaking up. I am contacting my elected representatives, the senators from Pennsylvania, the Congress people from Pennsylvania. I'm contacting the new crew at the Justice Department, Attorney General Pam Bondi. I'm writing letters to her. I'm writing letters to President Trump, just to alert them about what's going on, about the campaign that the Justice Department has had on physicians unnecessarily. We're going to end up with no physicians available for the community if they continue on doing this. So a shift in priorities, I think, is coming with this new administration. President Trump is definitely doing the right thing to assist physicians. But we're speaking up, publishing articles, blogs, talking to your show, publishing a book. I have one book, which is Doctor Not Guilty. I have another book that's coming, is People v. Medicine. And I'll be happy to come and talk to you once these books are published. But they include a lot of stories, a lot of calamities that happened around the country of physicians that got prosecuted by the government, that went to jail, and that experienced significant injustice. With the Department of Justice kind of making up things, and just anything that a doctor does, basically they criminalize it. So we're just going to speak up. We're going to continue to talk and speak up about it, and not remain silent. I think one of our faults was that we remained silent when things happened, and not a lot of physicians spoke up because they were afraid that they're going to be targeted. And I've already been targeted.
Yeah, here we are being targeted anyway. Doctors were silent to their own detriment.
I was targeted, so I'm speaking up. I'm here in my office. I'm still seeing patients, and I was exonerated. The jury found me completely not guilty, and within 1 month, all of my prescribing privileges and all of my billing privileges were restored by the government because they realized that what they did was unconscionable and unjust. And in fact, I'm actually fighting back. So I have filed a lawsuit against the United States Department of Justice, and I'm seeking attorney's fees, and I'm seeking damages, and I'm seeking actually defamation damages against the United States Department of Justice for basically maligning the profession of medicine and saying dirty doctors poison the community. We're not dirty doctors. We are healers. We're signers of the Declaration of Independence. We ratified the Constitution, and we're here to serve our community. And we're not here as drug dealers. We are healers, and we're here to serve the community.
Yeah, and we're quickly running out of time, but what do you think was the major difference between your court day in court and being able to be exonerated and poor Dr. Neil Anand?
I think it's a different jury. I was actually in a different courthouse. I was in a different city. He was in Philadelphia. I was in Reading, Pennsylvania, which is rural Pennsylvania. I had a rural jury that realized that there's not enough doctors. His jury was in Pennsylvania, in Philadelphia, where they had plenty of doctors, and it didn't matter. There's 3 universities there. It didn't matter. I was in a rural area, and people knew the value of physicians. It was a different jury. They knew the value of physicians. In Philadelphia, there's many doctors, and they didn't know the value of doctors. But you know that we're going to keep prosecuting doctors and putting doctors in jail until there's no more doctors to serve the community. We already have a shortage of doctors, and it's going to get worse. There's not going to be any doctors who are going to prescribe pain medications. They already prosecuted the majority of doctors. The numbers came down from about 10,000. Now there's only 4,000 doctors who are practicing pain management, and there's probably the numbers are going to go more down, and they're going to continue to target physicians. Now they're going after physicians who prescribe diet medications. They're going after physicians who prescribe medications that service the community, that prescribe medications that help ADHD, that medications that help anxiety. So they're just basically, they ran out of pain medicine doctors, and they're going under all the other controlled substances. And I don't know what's going to happen next. But basically, they do not want to go after the real targets, which are the cartels that are pouring in fentanyl for our communities. That's where the DEA needs to focus on. They need to send all of their agents to the border to protect our communities from the fentanyl that's pouring through the border.
Yeah. Or that's already here, and they won't get these folks out. Well, my time is up, Doctor, but we will definitely follow up with you. Keep us updated on your progress with your book, and let me know if there's anything else I can do other than trying to amplify these voices of those suffering. So thank you so much.
My pleasure. We appreciate you amplifying our voice and getting our voice to your audience.